Hey guys, let's get into placenta accreta today. So I know in school you learn about increta, procreta, and accreta. Accreta is more common, so I decided to discuss that today. I pulled up the ACOG's definition of placenta accreta, and it's defined as abnormal trophoblast invasion of part or all of the placenta into the myometrium of the uterine wall. You're going to be focusing on three distinct features. You're going to be focusing on lacunae, turbulent lacunar flow, and loss of hypoechoic zone, which is the area in between myometrium and placenta. Here you have a really good image of the top left here is your myometrium. The right here is basically the placenta is adhering to that myometrium, is not truly invading it. But you can see like the thinning of this area. So like I said, the hypoechoic zone in the middle is what's in between myometrium and placenta, and that thins out with this accreta. Here's another good image of the thinning of the hypoechoic zone where those arrows are. And then also this placenta is very lobulated and it's filled with lacunae, which is the black areas you see in the middle. Here you notice that our lacunae has increased turbulent flow. So once again, that's a tall tale sign. You'll see lots of flow within those lacunae spaces, and then you'll also see some subplacental vascularities. So once again, that's an area to look at while you're assessing the placenta. Here's another image of lacunae, and as we see in sonography terms, this is a Swiss cheese appearance. And once again, what you'll do is you'll throw your color Doppler or power Doppler on. Well, we know power Doppler is more sensitive, but so you can use either or, but if you use color, it'll still light up because that's one of the signs of an accreta. And yeah, so I would also show that as well. Here's an image of a normal versus an accreta. The normal is the arrows are pointing to that hypoechoic zone, which is the area in between placenta and myometrium. And that looks, it's more hypoechoic. So you can actually see the subtleties in the echogenicities, right? The accreta looks totally different. The accreta, that placenta is lobulated, it's more echogenic, there's lacunae, I don't even see a hypoechoic zone in that image, but there is one. It's just very, very, very thin. Once again, very subtle. So, in some MFMs, they have a accreta protocol. Sometimes they will have you, whatever the protocol is. I worked at some places where they had you increase your image to where the C-section scar is, and you just take some live clips, you put color, you just really deeply get magnified into that area. Once again, whatever the protocol is at your site, follow it, and just train your eye. There's multiple sites to go on. I'll plug in the ACOG at the end here, which is the American College of Obstetrics and Gynecology. And, there's a bunch of findings and everything, like stats. And I also wanted to add the risk factors for accreta are mothers who had C-sections or any type of uterine surgery. And or a previa. So even if there is no history of a C-section and there's a previa, an accreta still can occur, or vice versa, but the more C-sections, the more risk of getting an accreta. So once again, just look in the patient's chart, get their history, see what's going on, and once you see these images and you train your eye and you make yourself familiar, you should be able to help your MFM diagnose an accreta. All right, I'll plug the website in the end. Thank you. Have a nice night.